Welcome to Thrive Functional Health Podcast. I'm Tara Peterson, and today we're diving deep into an inspiring patient success story. How someone went from a diabetes risk to thriving in health. We're going to break down today exactly what worked for them, the functional medicine strategies that made all the difference, and how maybe you can apply some of these same tips into your own life. Plus, we'll touch on one of the biggest health trends right now, longevity versus lifespan, how people are shifting from just wanting to live longer to actually living a better quality of life for as long as possible. Thought leaders like Casey Means and Mark Hyman, maybe you've heard them speaking about this, and we're going to break that down into a conversation and discuss what this means for you. All right, let's get started. This is my favorite topic to talk about, preventing disease naturally, and just getting to share with you one of our amazing patients' journey, how they really turned the tide in their health. We had this particular patient came to us seeking help for hypothyroidism. If you're not for sure what that is, that just means their thyroid was underproducing T3 and T4. That's what they had been told from their primary care physician. They were always also looking for weight loss, and their health was in far more danger than they even realized. We'll put in the show notes a link where you can look at the real lab results that this patient went through, what they started with, and then what they ended up with. To break that down, the lab results showed on their first findings that their A1C was at 7.9%. And that's in the diabetic range, and they didn't even know it. And along with that, they also had in their lipid panel, they found that they had high cholesterol and triglycerides. And this really was putting them on a path towards cardiovascular disease. So you may, if you haven't been tested for any of those, you certainly want to start there, along with many of the other markers that could fine-tune and allow the blueprint for how to best help. So many people, including this patient, did not even realize they're already in metabolic dysfunction, because a lot of times, unfortunately, in traditional healthcare models, it's often found too late. So it's not until you're in the full-blown disease symptoms before any action is taken place. So functional medicine does things a little bit differently. We look ahead. We're looking at preventing, identifying, and addressing root causes before they become a chronic disease. So our comprehensive testing reveals that this particular patient had not only hypothyroidism, which they already knew from their doctor, but that it was actually an autoimmune condition. And so one of the most common reasons for hypothyroidism is an autoimmune condition called Hashimoto's thyroiditis. And so this changes our course of action on how to help best support people based off of this lab result that they were unaware of. So conventional medicine had overlooked this because they never ran a full thyroid panel. The laboratory markers that we include for our panel has 8 different thyroid markers. Usually you just get one, or I've even had patients come to me and say, hey, we got the big panel from our doctor, and that was 3. And so really not as conclusive as the 8 markers that we use on our panel. This particular patient, their diabetes risk had also gone unnoticed because they never had an A1C test done before. They had their glucose, their fasting glucose, but not their A1C. And more than 96 million Americans are pre-diabetic, and 80% of them have no idea. And so by digging deeper with functional lab testing, we found the real triggers for their health issues were blood sugar dysregulation, chronic inflammation, and then an autoimmune attack on their thyroid. So rather than turning into medication as the first step, what we did is we focused on strategic lifestyle intervention, Some of the things that allowed this patient to be successful is we used a continuous glucose monitor to track how does food affect their blood sugar. We had a personalized nutrition based off of that and their findings. This patient, unfortunately, one of the triggers for them was gluten, and so cutting out gluten and inflammatory foods allowed them to really heal from the inside out and to really shed a lot of weight. So we prioritize whole, nutrient-dense foods over overly processed, sugar-laden ones, and the result is, from this particular patient, that their A1C dropped from 7.9% to 5.8%. So completely out of the diabetic range, and we were really excited for them and was excited that we were able to share that experience with them. As a side effect, it wasn't our focus, but they lost 48 pounds naturally. Their blood sugar normalized, their thyroid function improved so much that their primary care physician was allowed them to lower their medication. So actually their primary care physician and specialists were really shocked by the types of results, and this is not rare. This is not a one situation. This is results that we are achieving with many of our patients. So, and it's from finding the root cause. One topic and that's related to this patient's story, and they would tell you that one of their goals was to have longevity in life and not necessarily lifespan. And maybe you've heard a lot of chatter about this, so I wanted to make sure to touch base on that today, because people are realizing that living longer isn't really the big goal, but they really want to live well for longer. And so that's really the difference between longevity and lifespan. It's not just living long, but living longer better. And so maybe you've heard people like Casey Means or Mark Hyman and emphasizing metabolic health as the key to longevity. And our patient success story really proves this is the case. And then functional medicine is really come along in the forefront of this movement because we focus on prevention, optimization, and quality of life rather than just waiting for the disease. And that way you can have an action plan before. So whether if you're in your 60s or 70s or 80s, you probably don't want to be spending most of that time frame managing medications and joint pain and fatigue, but instead fill it with energy and mobility and mental clarity. So that's really the difference between lifespan and longevity. So the key to longevity isn't found in a pill. It's found in your daily choices, in your lifestyle, in your mood, in your food, in your nutrition, and then really ultimately your mindset, because it really starts at that positive mindset and being willing to make some changes. So if this story resonates with you and you're wondering, could I be heading with the same risk? Now is the time to act. Schedule a free health consultation. We'll create a customized plan to prevent disease, improve energy. We can test with our panel so that we can really find the root cause and help you set yourself up for longevity. You can visit our website. We have a lot of information on there, blogs and links to other podcasts and a lot of good information to get started. So if you'd enjoyed this episode, I would just love it if you would share it with someone who needs to hear this, and just put in the comments what you enjoyed about it. Your health is in your hands, and we're just so excited to be able to join with you in that journey and help you get the best results and thriving at life.